Like, let's just try. How do you guys look?
Her thing is muted.
If my computer is muted, okay, it's fine. Yeah, like that's the volume now. We just need to get somebody able to hear us now. Okay, or maybe Dr. Ehi, if your Ehi, if your thing is on, can you hear us?
Tyra, would you just repeat that? A bit of fluctuation in your audio.
Dr. Ngozi and Dr. hear us. This is Tyra and Jackie.
Hello, can you hear?
I can hear you and I can see you.
Perfect.
So that's good. I think we just got word that there are people who are starting to join us. And so with that, we'll just wait a minute or so.
Yes, we're going to do a minute to let people join us here online.
Tyra, you ready?
Yes.
Okay, because we have participants that are waiting, and two of them are my colleagues.
Okay. So I think we're ready here. If all the panelists are ready as well, we'll just have the folks coordinating to start letting folks in. Yeah.
So that should just happen in about a minute.
Okay, so we have folks who are joining us. We're now 5 minutes past the 3 o'clock start time. That's okay.
Jesus Christ.
All right, we're going to go ahead and get started. Thank everyone who's in already and who's joining for joining us today. We're really excited about this particular topic and the group of panelists and speakers that we have on today. My name is Jackie Ugokwe, and I am the co-moderator, and I have my colleague Tyra Farm, who's also my fellow co-moderator. We're both members of Africa Policy Conversations. And if you don't know too much about Africa Policy Conversations, we definitely implore you to check out our website, theafpc.org. We're a group of young people who are focused and passionate about policy in Africa, not only Nigeria, but really like all the continents, all the countries in Africa. And we're really passionate about changing what we see and making sure that policies are put in place that, you know, help our generation and the generations to come. And we'll go ahead and jump in. Please feel free to ask questions in the chat box, and definitely we'll be sure to get those questions towards the end when our speakers finish kind of going through their panels. So thank you once again, and we look forward to a great conversation.
All right, thank you, Jackie. As you just introduced me, I'm Tyra, and a brief intro for our webinar today. Speaking of policy, one of the most relevant conversations in our time and since last year has been COVID and the response to COVID, whether it's the health response or economic response. And so as AFPC, we've wanted to explore those topics further to really discuss how we're handling the policy aspects of our response to COVID. We're going to look at it in different aspects or dimensions. So starting with the health conversation, obviously, because it is a pandemic and the health response seems to be what's most prominent. But subsequently in the series, we'll explore other aspects of the COVID response as well. So today we'll be talking about the health strategies that we've been using to combat the pandemic in Africa specifically, and we want to explore how we've been contextualizing our response in Africa. And then we want to talk about the way forward, which revolves around the conversation with vaccination, vaccines, vaccine manufacturing, and just any other strategies and ways that we can continue to build ourselves on the continent and build our health sovereignty so that we're more self-reliant if we should ever find ourselves in a similar situation in the future. So with that, I think we have our panelists online who will introduce themselves, and then we'll have a brief intro to our Africa response from Dr. Ehi. So I would call on different panelists to introduce themselves. Can we just start with Dr. Ehi Igumbo?
Right. Thanks, Tyra, and greetings to all who have joined the session. My name is Ehi Gumbo. I am a professor of epidemiology, and I support the Nigeria Center for Disease Control as a senior epidemiology advisor to the Director General of the NCDC. Really pleased to be on the platform. Thank you. Over.
Thank you, Dr. Igumbo. We also have Dr. Ngozika Ojioke. So I'll just call on her to quickly give us an introduction as well.
All right, so I'm Ngozi Orjoke, and basically I'm an intensivist. I'm also a pulmonologist. So practice here in the United States, did my medical training in Nigeria, but came out to work for a little stint in Australia, and then came out to the United States where I did an internal medicine residency and went ahead to do a fellowship in pulmonary and critical care. And so, of course, I've been in the heat of COVID. And part of some of the things we did here was being able to build COVID units and also begin to have conversations with the minority populations about healthcare issues, including vaccination and administration of vaccinations. And again, I'm absolutely thrilled to be a part of this conversation this morning. Thank you.
Thank you for that. Can I call on Mr. Chike Nwangu to give us an
Hi, thanks, Tyra. The name is Dr. Chike Nwangu. I'm the Chief Executive Officer of NOI Polls. We're a public opinion organization in Nigeria, and we're polling Nigerians' opinion about several topical issues that affect Nigerians. And we started polling on what Nigerians think about the COVID right from the initial instance. And we've done quite a lot of extensive polls trying to gauge where Nigerians are, what they think about the disease, what they think should be done, and how things that are being done affects them on a day-to-day basis. I'm happy to be here to have this conversation. Thank you.
Thank you, that's fantastic. And then also we have, thank you, Dr. Chike. We also have Dr. James on the line. Dr. James, could you Dr. James, you're muted, so you might want to check that. We can't hear you currently.
Oh, I apologize. So, hi everyone, and I'm so delighted to be part of this conversations that I'll be having this afternoon. I'm Ayo James. I'm a research fellow at the Nigerian Institute of Medical Research, and I'm a biochemist by training, and the lead design for recombinant or peptide vaccines, which is a new thing that we had been looking at even prior to COVID. And when COVID came, it became more of a need for us to pursue that angle. So since COVID, we've been highly involved in some sequencing, trying to grow the virus as well, trying to characterize the virus in our institute. And we've been looking at vaccine possibilities from recombinant peptides. So we'll be doing a lot of cloning experiments and trying to see how we could work with some of the strains that we've grown in making killed vaccines. Thank you very much. So I look forward to learning from the other panelists.
Thank you so much. Thank you so much. It's a pleasure to have you all with us today, and I'm sure we're going to have a very robust conversation, with the representation that we have here. So I'll just hand over to Dr. Igumbo, who's going to give us a quick summary of our COVID health response, and then based on that, we could start to have some conversations with our panelists.
Great. Thanks, Tyra, and greetings to colleagues again. Absolute delight to be part of this discussions. In putting a 3-4 minutes session together, I thought a very handy and accessible presentation is what we had documented together in the Nigeria Center for Disease Control around what the public health response has been within the first year. So I'm sharing a screen on screen now, a material you could easily access off our COVID-19 website, and just to highlight on the more pertinent aspects of the response. in many ways, COVID-19 has been very unprecedented in what it has meant to Nigeria. And the NCDC is framed really as the public health agency and was saddled with the need to respond using all of its, the gamut of the public health interventions that it had within its fingertips. But COVID-19, whilst NCDC had responded quite successfully to previous outbreaks, Ebola in 2014 is a very reminiscent one, but other large outbreaks, Lassa fever, yellow fever, monkeypox, cholera, meningitis, you name it, we've seen all of our responses in the last couple of years to these various outbreaks. And COVID-19 was very much unprecedented. It was definitely the first pandemic that the NCDC had to respond to. And immediately our response was rallied around a slogan of take responsibility. Essentially calling on Nigerians to embrace it and all role players taking responsibility. I will quickly scat through the response from the NCDC angle by framing what happened in terms of the leadership and governance, how we put data at the heart of the response, how we had to rapidly expand diagnostics in testing, our response to the healthcare workers and infection prevention and control. But I would also draw, and so pleased to see Chike and others involved in polling, the twin endemic that we had to actually contend with, how we had to fight an infodemic around the pandemic. The last parts of the conversation will be how do we get to our supplies to what we call the last mile, and our general efforts at providing care for COVID cases and some kind of intro into what we have done with ports of entry. And there are other really interesting aspects of this read. The efforts have been largely steered by our truly dynamic lead in Dr. Chikwe Yekwazo, but quite soon after the response the COVID epidemic got onto Nigeria, the Presidential Task Force was constituted in about March, and that, brought in very multiple role players, and notably the Federal Ministry of Health and the various agencies and departments therein, but NCDC remained very central in its focus. And NCDC had these leveled pillars around which it was able to offer this sorts of response. I would go straight to some very interesting contextual bits in framing what we had to do from the start. Colleagues on the call may be familiar with the joint external evaluation, which the WHO does in scoring countries around their readiness for health crisis. And by 2017, we weren't doing too great on our JEE scores in Nigeria. We scored 39%. And, by mid-2019, we had only improved to shy of 50%. That's essentially saying that, we were less than half ready in the event of, an epidemic. So NCDC had to, for its public health response, very quickly activate a preparedness plan and run with a chain of activities. These involved, flagging off several events, and working on expanding our treatment capacity through the labs, setting up response teams for surveillance and contact tracing, and watching what we do in terms of IPC and a host of others. Now, whilst this is all captured and documented, I therefore would not want to veer too much in details, but there's been a fair bit of trying to work with several multiple role players, activating rapid response teams, deploying them to all 36 states and the Federal Capital Territory, ensuring that surveillance was part of things. So we had our rapid situation reports and working through a case-based surveillance system, something we call SOMAS, and just ensuring that we had testing facilities across the country. At the start, we had potentially 3-4 labs that could have done a molecular test and be able to diagnose COVID. And today we are sitting with in excess of 120 labs. So, I mean, getting that kind of volume and scale around things is certainly something that's quite an impressive feat. We had a connect center where we had to deal with the public and respond to health workers who were at the time unfamiliar with this novel condition and really just get all the works together in a public health response. On screen to your right is just charting out the spread of our labs between last year, February 2020, and this year. And you could see the green fields in terms of our penetration and improved laboratory network. There was a lot of things that had to go in getting that to happen. Lots of adaptations. We were not a country with, a Soviet of resources. So we got GeneXpert machines. We got machines that were used for TB and HIV and repurposed them for COVID investigations. Moving along, infection prevention and control, very key. Health workers at the front line, how could we spare them? There was a whole response around it, securing PPEs and training health workers on IPC across the country, even within our context. Something I really want to flag up and has multiple policy ramifications is around how we had to deal with the infodemic. Almost per second, there was always a more derailing news around COVID-19 that had great potential to halt any progress we made. And we had to respond to these and so quickly and using all that we could within the social media space and all of our information networks. There were other things. You're dealing with a country, and we stress this a lot. We had to work with the country we have, not the country we wish we had. The country we have is one that is challenged by logistics, one that has its transport infrastructure in the way it is, that has its supply chains the way they are. And it was true challenge trying to get materials to where they should be going to. And both from network and connectivity and a host of others to information systems to guide all of that. I will just cut through again. In terms of treatment and care, a massive response in concert with the Federal Ministry of Health and respective state Ministry of Health. States activated their primary health care, their public health emergency operations centers, and we worked very closely with them in seeing that treatment centers had what they needed, including updates on clinical guidelines and setting up an activation of a true response team. We worked with the Port Health Authority and we informed several policy decisions around the closing of international borders and subsequently its reopening and things of the like. Strong partnerships were core. We worked with several groups, multilateral agencies, bilateral agencies, and several support and implementing partners. I do want to flag an area I feel especially proud of our response. We have really put science, research, and development to drive much of what we have needed to do. And several publications have come out from our efforts, but notably, we've nurtured a new formation, the National Nigerian COVID-19 Research Coalition, that brings together various research entities in the country and works on developing science to guide the response. At state level, massive interaction. We know the layered structure in the context of Nigeria, where you have the federal structure and states running concurrent functions. And we again responded and worked very closely with them. I will wind up then in just flagging some of our general thoughts on how we intend to continue to sustain some of the activities that we're doing. We have a good information platform in SUMMERS, which is an event-based surveillance system that keeps us on track on knowing where the epidemics are coming on and so on. We've been doing a number of sero surveys across communities to get from a population level perspective around what is happening. But with the networks that we've been able to build, our intention is certainly to sustain this response and to continue to do better in the way we handle things. We've got lots of partners that have worked with us, and I think a tagline really is that partnership is so central in the response. There are certainly very detailed documentaries, documentation that we have given around what we have done. And we have also tried to certainly speak very much about so giving some kind of evaluative discussions around it. So just to wind up in then saying that any new infectious disease is certainly a cause of concern, and COVID-19 has been no exception for us. There's still a lot for us to do in preparing for outbreaks in the country. And as we start getting ready to handle things, we really must think very much about the tag mantra we took on: everybody chiming in, everyone taking responsibility, and working together in our response to the epidemic. That's been our experience from Nigeria. Colleagues in other African countries relay very similar kind of stories around how they have responded. Thanks indeed, Tyra. I see the nod. I will pause at this point and happy to engage further. And thank you. Over.
Okay. Thank you so much, Dr. Igumbo. That was very comprehensive, and we can see that there's just so much that is going into the response. And so we have a lot to discuss today.
All right, thank you once again. So I think, with that, we can actually jump right into our panel session. Sort of the first portion of what we want to discuss today is really contextualization of the COVID health response, at a local and global, or local and global influences on key strategies. We conducted a little poll here on our end, really just kind of taking a look. It was a little bit more specific to vaccines, so we'll get to that probably in the vaccine segment. We're just kind of looking at the sentiment and looking at how, both Nigeria, once again, and other African countries have sort of responded, how people have responded, how populations have responded, and how governments as well have responded, to COVID-19 has just been kind of vast all over the place. But, like we said today, we want to hear from our experts here. One of the first questions I would like to ask, and really I'm posing this to the group to kind of go through, and everyone can kind of give their little piece here on what they feel the response, what their own opinion is on this question. So how have you been encouraged by the responses taken by the Nigerian government or any other African government, right? So it could be a scenario where Nigeria has, done, a certain amount, right? But are there even other African countries that we can look to and say, oh, maybe they did it better? What are your opinions on the responses to COVID-19 from Nigeria and across other African countries? I'll go ahead and actually start with Dr. Chike to go off and begin answering. Thank you.
Okay. Thanks, Jackie, and thanks, Dr. Ehi, for laying the foundation for this conversation. I think it's really critical that we have a kind of a big picture of what the country has done in trying to tackle this epidemic from the Nigerian perspective, and I think that's kind of what we need to tailor this conversation around, as in we are all in Nigeria and we need to discuss how this affects us as a country going forward. In answering your question, as how encouraged have I been? I think I have been very encouraged with how the government has gone about the the response, because one, I think the response that we did in Nigeria was very country specific, as opposed to taking whatever model that works in other countries and trying to implement it in Nigeria. Like Dr. He mentioned, there was a very concerted effort by the government to get opinions across all partners, all stakeholders that have a stake in this, in either the response of the, because you need to look at the response from two perspectives. There's the health response, and then there has to be an economic response, because the country was shut down, to just put it in very simple terms. So it wasn't just about focusing on the health response. You need to also have an idea that whatever policies or ideas that you put in place to check the virus might have a long-term effect on the economic situations of the citizens, and also to try and develop things that can help to cushion those effects. I'm sure we'll get to that at that point. I wouldn't say that the country did excellently well, or there were things that they could have done a lot better, particularly in managing the economic effects or the fallout of the response strategy. But when it comes to the response strategy, health-wise, I think the country really tried. And I was encouraged in the fact of how they set up the information collection, how they set up with putting in place policies. Yes, they could have done some things a lot quicker, but I mean, hindsight is 2020. But the response, in my own opinion, as in a lot could be learned from what was done. And most importantly for me, the thing that impressed me the most was the number of hands, let me use the word, number of hands that were on deck trying to put things together. And you all know that the more, and it's also a credit to the NCDC for being able to coordinate, because you and I know that the more hands you have on deck, the easier it is for things to just go all over the place. But I was very encouraged by the country's response. Thanks.
Thank you, Dr. Chike. And your sentiments are
Jackie, sorry, you're on mute, so we can't hear you.
Sorry, can anyone hear me now? Okay, I think we're good. No, I was saying thank you, Dr. Chike, for your comments. We'll move over to Dr. Ngozika. Any opinions or encouraged, maybe even discouraged, right, of how the Nigerian government handled the pandemic, or other African countries as well?
Okay, so I'm going to, I guess my perspective is going to be a little different, because I practiced in the critical care setting in the US during the pandemic. And so when you give yourself a pat on the back about what was done, I can understand that, because the responses that were made by the Nigerian government in Nigeria were context-specific responses. So if I compare what was done there to what was done here in the US, it's absolutely completely different. But what I want to say first is that a lot of the focus for people who have been outside of the country, especially medical professionals, a lot of the times we've tended to focus on the things that were missed, neglected policy choices, what went wrong with implementation, what could have been done better. And there was a lot of skepticism about testing and reporting. The first speaker spoke about the infodemic. So there were issues of trust. So quite a few people didn't actually trust a lot of those figures and information that was being displayed and published by the government. They felt that those numbers were doctored. And again, it was part of managing the infodemic. And I also think that some of the successes we had in Nigeria were overshadowed by the complexity and the severity of the illness and the pandemic. So I think Nigeria did great with border patrol. I think it did great in not letting people in and also limiting who went out. And so I think that was one of the things that were absolutely phenomenal in terms of being able to contain the virus. And I also think the African subcontinent and the African continent did well, because they formed the union, the African Center of Disease Control. There was an African task force on the on the coronavirus. So they were trying to make sure we were getting critical equipment in terms of masks and sanitizers, things like that. And right now, I think they're in the process of also negotiating vaccine purchase for the continent as a whole. So those things were great. But some of the things that we were not ready for was if someone truly was sick and sick enough to need critical care support and ventilator management, there was nothing we could do. There was nothing we could do. We didn't have enough ventilators. We didn't have personnel trained to do that. So I think, again, yes, we did well in some areas, but there is a host of things we can do to do a lot better, because if we were hit hard with this pandemic, it would have gone down a lot worse. And so I think it's a two-edged sword. There were things we did extremely well. There are things we can do a lot better by getting the policy in place, training in place, strategies in place, to know that if this had gone any other way that it did, that we have things in place that can help us do a lot better than what we did and kind of move us forward in terms of healthcare policy and strategy.
Thank you very much, Dr. Ngozika. And I think I, completely agree with some of your comments there. It's a scenario where there was the good, where we were prepared, because just based off of context, right, what we've been through on the continent and what we've been through as a country here in Nigeria. But there are definitely places where there could have been room for improvements, where there's still currently room for improvement, right? Barring that there is another pandemic that comes up fairly quickly, or we're all hoping that does not happen. Let's get through this one already. But completely agree. Dr. Aya, we'd love to hear some of your sentiments as well, and what you think.
Hello, I didn't get that. I'm sorry, please.
Oh, I hope people can hear me. Did you? Okay, so the question is, have you been encouraged by responses taken by the Nigerian government or any other African country?
Yes, I think to a certain extent, I think we actually did our best in our own capacity, because many times you find yourself in a situation where you can't do more than what you have the capacity to do. And a big kudos to what NCDC was able to do during the outbreak. And but I think NCDC had so much to do that other health, institutions, could not even contribute as well as NCDC. So that and I'm not sure of what the primary role of NCDC is, but to a certain extent, I think the information out there is that they are in charge of infection control and management. And that is not all that is needed, in an outbreak response, like the last panelist said, that because a lot of people needed ventilators, a lot of people needed critical health care, and we're really down, in those areas. So to a certain extent, we did our best in our own capacity, because we had very few testing labs, and in very few months, we're able to ramp up, the number of testing labs. And in an outbreak situation, many times testing is critical and testing is key, in stemming the scourge of the outbreak. So to a certain extent, I think we did well. Thank you.
Okay.
Thank you.
Thank you.
Okay, thank you for that. I think we really wanted to kind of focus on this question, because I think the perception of the efforts from the government, or the impact of the strategy that we're deploying, matters a lot, because between the infodemic and other things that we're working against, is really important that the people understand and translate government policies, and so that they're able to fit into that. And so we wanted to do a quick poll for our participants now. We've heard from our panelists what their thoughts are on how they would rate our government's responses, and how they were inspired either by Nigerian government response or African. So we'd love to hear from participants as well. We'll put up a quick poll just now to see if our participants agree, or how they feel about the government's response thus far. Okay, so while we're waiting for the poll to come through, I just kind of wanted to follow up with the conversation we're having now. We've highlighted some of the things that worked, but also we've highlighted some of the things that we could have done better with. So there's been a lot of conversation around the topic of the lockdown measures and how we adopted that and how effective it was for us as a whole. And so especially for developing countries and for low to middle income countries, there's been a lot of debates. There's recently been some research done by Yale University that alludes to the fact that the lockdown measure was not quite an effective strategy for low-income countries as it was for more developed nations. And this is because if you're looking at it from a cost-benefit angle, the economic cost of the lockdown and the loss that these countries will suffer and individuals will suffer, and compare it to the benefits of the lockdown, or at least the perceived benefits based on how we were able to implement it and what impact it had, that it just doesn't match up. So simply put, there are people who perhaps are hungry and are jobless. And so the idea of, or the potential of falling ill did not really compare for them as to the reality of dying of hunger. So that's just to simplify what that research paper was trying to say. So I guess I wanted to ask a few of our panelists here what their thoughts are on this. Do you think that we were able to successfully implement lockdown measures? Do you think that it was right for our context, or was this one of those things that maybe we were hasty to copy? So I will start with Dr. Igumbo, if we could hear your response and maybe from one or two other panelists.
Great. Thanks, Tyra. And yeah, the benefit of hindsight is always something we ploy on. So as we think about things in hindsight, indeed we begin to see that there may have been a couple of overkills in the extent things went in terms of containment. But at the time of decisions were being made, these were very, there was a whole balancing act. What were we to do if we had 1,000 more infections in our hospitals without ventilators? It was a novel condition. We were clueless about the clinical sequelae of disease and how severe it would have been. We may remember the doomsday forecast that was made about what things could be in Africa. And need I say, we're perhaps not out of the woods yet. India was having these sorts of conversations we're having a few months ago. Things didn't play out the way they did in India, but they're on dire straits now. So in hindsight, yes, there could have been areas we could have been more targeted. But at the same time, we did not have all it takes to gather the necessary information for some kind of precision public health. And knowing our weak systems of enforcement, it would have been very dangerous to actually be so targeted, because again, we wouldn't be able to enforce as carefully as we need to. So I'm quite ambivalent about this point. I just wrestle with the point where I say I'm grateful given what we have and the circumstances in which we had to make the decisions, with the decisions we took and the outcome that we have seen. And thank you. Over.
Well said. Thank you, Dr. Igumbo. I'll just take a quick pause to note that the polls have now come up. You will see on your screen. We have a few questions that maybe we would love your feedback. So as an attendee, please just quickly fill those out, and we'd love to share during this session what the opinion was. And also, I just want to quickly introduce, we've had a panelist just join us, Dr. Hadley. So if I could call on Dr. Hadley to quickly introduce himself, if you can come off mute and put your video on so we can see your face, and then we can continue with the conversation.
Yeah, thank you so much, everyone. I hope you can hear me clearly. So I think my network's been fluctuating.
Yeah. Oh, we lost you just now. We heard you at first and then we lost you. We were quite excited there. Okay, so we'll try and get Dr. Hadley back online. But just to continue on the conversation, I think that was a very insightful answer that we got from Dr. Igumbo. Hi, Dr. Hadley. We can't hear you. Okay, so we lost Dr. Hadley just now. In continuing with that conversation, I wanted to call Dr. Chike to also kind of chip in here, especially coming from some of the data you may be privy to from any polls that NOI has done. What do you think has been the feedback on this, whether or not the lockdown measures were well received or people thought it was as effective as it was intended, and whether it was, a good strategy for us at the time, especially as Dr. Igumbo pointed out, knowing what we knew then, hindsight permitting, but I don't know if you have any feedback here.
Yeah, thanks, Tara, and thanks everyone that's spoken so far. Yes, we did ask questions around people's opinions around the lockdown, whether they were in support of it. And majority of Nigerians were in support of the lockdown, particularly when it was done. I'm speaking of around the time when we just had FCT, Lagos, and I think Kano at some point that were on lockdown. So yes, during that, the polls showed that people were in support of the lockdown measures. Speaking personally from my own, I'm not ambivalent. I am very supportive of the lockdown. Like Dr. Ngozi mentioned, in as much as because you do have to manage the pandemic within the context of what you have. We didn't have the medical need, as in we didn't have what we need to manage this pandemic if it became a medical emergency. So I think our best bet was to prevent the spread and prevent it from getting to the stage where the whole health system is bogged down by a number of cases. So I think the lockdown served the purpose. Yes, there are a lot of things that they could have done better with the lockdown in terms of managing how the palliatives were being distributed and making sure that people don't have more motivation to be out than to be in. Like you rightly said from the research that has been done, when you do a lockdown, you need to manage people's motivation, whether they are going to be able to keep to that. But I think there's something that Dr. Ngozi mentioned that was very reflective in our polls, and maybe down the conversation we can revisit on that. There was a very big issue of trust for whatever information that was coming from government. So it wasn't, and from the polls we're puzzled because we're getting conflicting responses from the same people. As in, so in using, for example, people didn't believe the numbers that were being pushed out as that they were the real number of cases in Nigeria. But on one end, they'll say, no, I don't think these numbers are real. I think they're underreporting. And then down the question line, they'll be like, no, they're inflating the number so that they'll get more funds. So in real sense, it was just a question of people not trusting the source of information that was coming to them. So I think in that regards, that's something that we might need to reflect on. How do we manage the break of trust when it comes to managing pandemics? Because you really do need people to trust your information for them to follow the things that you're asking them to do. Thank you.
No, I think great points, right? And speaking of trust, I think this flows into the next question that I wanted to sort of ask here is, what do we think is important for decision makers and community leaders as well to do during a crisis, or a pandemic such as this, right? What are some of the things that can maybe even help build this trust or help ease the population or people into absorbing the information that's being thrown at them? I know looking at it obviously now in 20, hindsight is 2020, right, at this point. But kind of looking back at it, we can see that even a lot of times decision makers, community leaders were likely confused as well. This is all new to us, and none of us really knew what was going on. But what are some of the things that kind of just looking back that decision makers and community leaders can do, during a crisis like this? And I would love to hear the perspective of Dr. Ngozika on this. Just even from the view looking in, right? Looking from the US, looking into Nigeria, looking to other African countries. What are some of your opinions there?
All right, how much time do I have? Because I could go on this for the next 48 hours. because trust is not something that's done overnight. It's built based on relationship. And so if people never trusted information for the government or the government's thoughts towards them in terms of governance and thinking about them and caring about them, pandemic or no pandemic, whatever news, whatever information comes from the government will always be laced with some degree of mistrust. So it's built on relationship. And I use that and just as a backdrop, in the United States of America, the minority population is specifically the African American population is very distrusting of new health efforts, vaccines, research, whatever it is, because we have a horrible, horrible history of how we were mistreated and how we were used as guinea pigs for research. And so when the vaccines came out and we started taking vaccines, they used people like me because I had already built a community of patients that I see that trusted me. They knew that I would not do anything that was going to hurt them. And what was that based on? Based on relationships that we have built over the years because I've been their pulmonologist. So trust is something that the government is going to have to build with its people over a period of time. It's not going to happen overnight. And so the first thing to do is to make sure that information that comes out of the presidency, out of national parastatals is always the truth, even if it is not palatable, it is the truth. So the next time you tell me that 20 people died from COVID, I will not say, oh, there were probably 600 people that died, but they're making it 20. Or I'll say, oh, they're just making it 20, so they make me believe anything that they want me to believe. So it's just built on relationship. It's going to be built over time, and it's not something that's going to happen overnight.
No, agreed. I think, to your point there, this is probably a very good learning point for us, right? In Nigeria or even, in Africa as well, and even in the United States, right, within minority, communities is, now I think leaders and community decision makers and community leaders can begin to try and foster, that trust and begin to sort of build upon what we have right now. Just not even hoping that, we're ready for the next pandemic, but just, in the future for other things, right? For other sort of, health situations, whether it be not specific vaccines for COVID-19, but vaccines for other things, right? Healthcare opportunities for other things kind of moving forward. So I agree. I think it's important that we start now and we look at this, and learn. All right, so I think that we will kind of flow into the next question here, just to sort of kind of rounding up a little bit on this particular segment. I don't know if we have the polls in just yet, if you wanted to kind of give in some answers there before we move on. Not yet. Oh, we don't have them yet. Okay, that's great. Right, we'll move in. Okay, so the next question that I wanted to pose, and Dr. Ayo, this will sort of be heading your way. What structures and policies do we need to put in place to prepare for the future incidences? What's your opinion on that?
Sorry, I didn't hear you, but I could.
Oh, sorry. Let me repeat the question. What structures and policies do we need to put in place to prepare for any future incidences?
Well, first and foremost, I think we need to invest significantly into research. What we've been talking about many times in Africa is how have we been able to respond to a pandemic, and and it shouldn't be all about responding all the time. Really, we should be talking about preparedness. How prepared are we? Because many of the things we're seeing, or some of the interventions we're getting, probably from vaccines, improved diagnostics, are based on templates of many years of research and many years of hard work and preparedness. So first and foremost, it's very essential that we recognize research as a big tool to national development. And many times in this part of the world, we feel research should be solely the responsibility of the government. It shouldn't be so all the time, even though the government should be charged with the responsibility of creating an enabling environment for research to thrive. However, research should be more of the public-private partnership, so that people can work together and improve and provide, quality policies, in preparing for the next pandemics that might come up. Thank you. Over.
Thank you so much, Dr. James, for that response. And we want to expand more on this conversation about preparedness. How do we look forward and prepare? And I recall from Dr. Ikumbo's presentation, you mentioned some of the indicators that we're looking at to measure preparedness for epidemics, pandemics. So based on that, since we just want to make it data focused, like how are we trying to see that we improve on those indicators? What specifically can we do to be better prepared in the future? And just looking at the response holistically. And so I guess I will call on Dr. Igumbo to begin with our initial response to that question.
Right. And thanks, Tara, for that. Yeah, certainly there's a whole gamut of things that, must be done. And shy of describing the entire waterfront, let's see some of the more, kind of pertinent ones. For starters, health systems need very much more investment in Africa. So if we think about what we're devoting currently to the health system, it's really paltry and can't do very much in terms of getting the traction needed to run, good health services. Now, if you took the whole pestle analysis around it and said, let's describe it in full and in detail, we find things cracks from end to end on different levels. I like the earlier speaker's comment on the need for more indigenous research, asking more context specific questions. And we push in that extent for more operational and implementation science research and things that are truly relevant within our context. The bit around continuing to work on building surveillance across our systems. COVID has, I like the expression, why waste an epidemic? In some sense, we've not wasted this epidemic with COVID. We have public health emergency operations centers now in every state of the country. Now, those need to continue to be sustained, and activities and around epidemic monitoring needs to grow in those areas. Building workforce around epidemic preparedness and response, extending, for example, we looked at data on the number of field epidemiologists we have per population in the continent, inclusive of Nigeria, and there are real gaps there. And developing programs that train in public health and will be quite useful. Supporting our health workers with the required IPC and ongoing training and capacity building of health workers would certainly be useful. It would be good again to also make sure that constantly we're having groups, and because of the structure of the health system in Nigeria, where states play such an important role, we need to see that at states, at more local level, and there's much support for them. I'm encouraged by the recent Bayelsa State Health Summit. More states should take leave, and Bayelsa State have announced they'll be forming their own CDC, a state level Center for Disease Control. So we need for thinking and initiatives like that really are engaged and work and giving the understandings that we have now developed out of COVID-19. I must not stop without referring back to the trust issue, and I fully agree with Ngozika and Chike on that. It's certainly, we have a long way. Government is strongly distrusted in Nigeria. I think NCDC would have had much more success in several spheres if we're not considered government. If we came in like a church group, except, well, we also need to come in like a Muslim group too. I'm sure would have gained a bit more support and trust. But we need to keep on building it and understand that these are human problems for which we truly need human and social interactions around. I'll pause there so the panelists too can chime in. And thank you.
Thank you so much. You raised quite a lot of, important points there that we can expand on for forever, but I'll just pick two things. If we can talk about those two things some more before we move into the next segment. The first is data, and then we'll just round up with this issue of trust. So on the data aspects, we've highlighted very early on in this conversation that, one of the challenges we had was, having reliable data to act on, to guide our decisions making and all of that. And so, even if we talk about surveillance and all of the other suggestions that we brought to the table here on how we can improve our preparedness for other pandemics, it still comes back to that foundation of having enough information and data. And so I wanted to pose this question to Dr. Chike. In, given our reality, in the absence of, complete, reliable data that we can use and we can act on, what would you recommend that we do? What would you suggest to policymakers as a way that we can compensate, I guess, for this lack or, address this challenge?
Thanks, Tara. Before I start, I'd like to say something. I don't think Nigeria lacks data. I think we actually do have data. It's just that they're not readily accessible in the form that people can use them. You'd be shocked that if you go to a Ministry of Health in, let's say, Zamfara State, and you're asking the number of patients that received care within a period of a month, it's somewhere on paper lying in someone's shelf. So it's in trying to, how do we make this data available for people to use to do something, as in it's making data actionable. I think that's kind of where the challenge is. I think the country, so this is my point in regards to your question, we need to have an active system that is continuous, not ad hoc, not passive, that it's continuously going. Dr. Ehi mentioned something about the Bielsa Health Summit, where they want to set up like a Bielsa CDC and things like that. Yes, we applaud that, but it'd be more important to be sure that that is put in law, as in made into a policy, so that the next government that comes in, it's not really up to them whether they're going to continue that conversation or whether that's a project that they're going to continue. Because sometimes things that are born out of this kind of situations is sustainability that is what the problem is. You'll see that a lot of things, like you mentioned, the Emergency Operations Center in every state that has happened from, that kind of, I knew there was a plan to kind of have it in phases, but COVID didn't allow that to take place. So, but the point is, do we now have policies that are going to make sure that these are sustained rather than dormant, and then the next outbreak when I'm going to start up and doing ad hoc things? So my thought is, in terms of how do we put these things in place, is one, to make sure that whatever things that we implement right now and that works should go into some form of policy so that they become sustainable. They have a budget line to them, and they have what they need to keep on running, irrespective of whichever administration comes in and whatever the focus or interest of that administration is going to be. I also totally support Dr. here that the NCDC as it is grossly underfunded, because permit me to digress a little bit. We're talking about COVID, but before the COVID, there's the Lassa fever outbreak. as it is, okay, I won't use the word pandemic, it's an epidemic on its own, but there wasn't a lot of focus on that. And the response to that is per season of the outbreak. But if the NCDC is funded enough that they can be able to operate within their own mandate, to be able to focus on disease surveillance and trying to manage outbreak of diseases, that will go a long way. And then to end this all, I think we can't run away from the fact that the government needs to build the trust with the people for them to be able to follow through with any policy that the government is trying to make. And how can you build the trust? Dr. Ngozi had given some points about getting people that they see on a day-to-day basis to talk to them. But I think also from our own perspective, the government has to stay on one lane. I don't know how best to say it, but to stay on one lane, keep the message consistent. That way people are going to know that whatever you're saying is, and then the final thing on that is to have the message be on a continuous basis. I don't know what it means. It's not, we don't wait until, pandemic, then somebody comes out to talk to us. After pandemic, someone goes back. Or there should be a database that people can go and they see what's going on. Thank you.
Thank you so much. You actually took my next questions right out of my mouth, because I really wanted us to come back to this issue of trust and come back to Dr. Ngozi on a comment that she made earlier, just so we can get more input on how we can explore building that trust more as we go forward, and especially as the infodemic is another major challenge that we need to combat. So since Dr. Chike has commented on that, just quickly before we share our poll results, if Dr. Ngozi have anything to add on the issue of trust and addressing the infodemic, we'll welcome that. And then maybe, yes, and specifically to policymakers, we'll take that quickly, and then we'll share the results from the poll that we did earlier.
Thanks. Thank you so much, Tyra. So, just before I speak on trust again and accountability with what the government puts out there, I think one of the approaches we have to learn to accept is that for healthcare to get to everyone, it has to be accessible, it has to be affordable, there has to be some sort of structure, and there has to be some sort of sustainability to it. And it has to be a pyramid approach, which means that you make sure people at the villages, our communities, our indigenous communities, they have access to clean water, they're educated about basic diet and nutrition. Our children are not dying and our women are not dying in childbirth because there isn't basic amenities available. And so if we build based on a pyramid approach where everyone has something that's available to them, that is affordable, that's accessible, then when we get to times like this, there is a platform. There is there's some sort of space we have created in basic healthcare that allows for us to make sure all these things are done. Now, in terms of trust, I'm just going to go back to the fact that if you're telling someone the truth on a consistent basis, and you're using people that they know, they see, community leaders that they look up to on a consistent basis, people will begin to learn to trust. You cannot say one thing today and tomorrow someone else comes and says something else. It's just basic, it's basic human relationship. It's basic social relationships. That's how you build trust. That's how you build trust. There is you can't run around it. You can't cut the process. You just have to learn to tell the truth and tell the truth on a consistent basis, and people will begin to believe what you're saying. So I don't know that there's a quick fix to it. It takes a long time to build and it takes a very short time to break, but you have to begin to work on doing that for the population and for the people of Nigeria to begin to believe the things that are sent to us as information coming from the government or from state parastatals. Thank you.
Thank you so much, Dr. Ngozi. And so just very quickly, we want to share the results from the polls we did earlier, and then we can segue into the next portion of the conversation. So yeah, we have it here. The first question is, to rate the government's management of the pandemic response, and this is good. I think most of the attendees that answered or responded agree with our panelists here that it was moderately done. And I think also looking at it in context of what information we had, and just COVID being such a new disease that everyone was struggling to understand. The second question was, did the government communicate clearly to ensure everyone had the information that they needed to protect themselves and others, regardless of their status? And we have 56% say no, which is higher than the number who said yes. And then finally, the third question is, did you trust the government's reports on the spread of the epidemic and statistics on the number of cases and deaths? And we have 78% that said no. And so, just to further demonstrate some of the conversations we've been having here, glad to see that, we're in agreement with our panelists, even with the participants, first of all, that we acknowledge that Africa as a whole did well in responding to this pandemic, given what we had. But then also we recognize that some of the issues and challenges still remain, building trust, building our information base, and addressing and communicating properly to ensure that everyone is carried along in our response. So thank you everyone for that. We'll quickly segue into the next portion of our conversation.
I think the polls are pretty interesting, right? And just listening once again to the sentiment of the speakers, just kind of seeing it reflect as well with the attendees. It's pretty interesting. I think that we're all pretty much somewhat aligned. But yeah, so sliding into the next segment here, we're going to talk a little bit more around vaccines. We know that it's kind of the hot topic now. In Nigeria, vaccination has been going on. In other parts of Africa as well, other African countries, vaccination has been going on. It's kind of a slow process, I would say, and that has a lot of factors that kind of come along with it. So I think one thing that would be kind of interesting to hear from of the group is or the topic we'd like to kind of push on today is local manufacturing of vaccines and other commodities and consumables. What are some of our thoughts around that? How are we on track? Is there work to do? What are some of those things that we actually can do? And I'll kind of go ahead here into my first quick question on this. So what do we think are some of the bottlenecks for Africa to manufacture enough vaccines to meet our own needs? What do we need to do to get there? And I'll actually start off with Dr. James on this to go in and kind of give your first thoughts.
Thank you very much. Well, the manufacturing of vaccines in Nigeria, I think we have a very long way to go. Even though we've started with a lot of preclinical studies, a lot of institutions have been able to come up with research groups that have identified candidate vaccines, or some candidate vaccines are currently being tested, in animal studies. But it takes quite a lot of funding, and not just funding, training and time, in developing a very good vaccine manufacturing structure in the country. So, but we've started, and I think it's nice that we've started, but honestly, we have a long way to go. But nonetheless, looking back, we should also note that Nigeria used to make yellow fever vaccines, and over the years there were some form of mismanagement, and the vaccine labs um, disappeared. But also, we also have the Nigerian Veterinary Research Institute in VOM, JOS, that have been making veterinary vaccines in the past 100 years, for about 100 years now, and they are still making vaccines for animals. So, what some strategies that some of us are beginning to look at is how have they been able to sustain, how they, their manufacturing process. Some people might argue that it's a bit different, manufacturing vaccines for animals is very different from manufacturing vaccines for humans. Yes, that's true because of the stringency, in the quality checks before you have a vaccine moving on to clinical trials. But the great thing is that that's really exciting to know is that a lot of institutions have been able to come up with candidates, and that's a good start because um, if you can come up with very good candidates and you begin to work on them, they could serve as templates, not just for COVID, but for some other, you know, common epidemics that we have in our in our localities, such as Lassa fever. Malaria is still a big problem, thanks to the vaccine efficacy of about 70% that they found in Ghana. But nonetheless, we still need to conduct more studies in other parts of Africa. And more so, we shouldn't just see vaccine production as, yes, we are making vaccines. We should also see it as a form of economic development and income to nations. So for me, I think we've started well, and we've started a journey, and a lot of people are beginning to look into vaccine manufacturing. In fact, in our institute, we've had several private investors coming to ask, what can you do? How fast can you go? And it's quite disappointing to say that, well, yes, for the preclinical stages, we have some candidates and we have to go through a lot of rigorous the quality of what we'll be doing, or the vaccines we'll be producing. But it's a good start in all. Thank you. Over.
Thank you so much, Dr. James. This conversation is a very interesting one because as we look into our future and our health sovereignty, this is a conversation we cannot avoid, not just for COVID, but also for routine vaccination. Our need for vaccines is just not going to go away soon. And even after COVID, we do need, it's a gap that we do need to address on the continent. I just want to share some quick status updates on efforts in the country, and then I also wanted to share some of the more specific work that is being done before we go into some more questions. So first of all, we know that Africa is about 17% of the world's population, and based on that, our current need for vaccines is about 1.3 billion, and that is even going to grow more, up to about 2.5 billion. And currently, we're not even able to produce 1% of our vaccines need. And we're so, dependent on other countries or other manufacturers to fulfill that need. And especially now that we have, the COVID conversation, and this is one of the key strategies nations are looking to try and make it out of the woods with this pandemic. We have to address that conversation about how do we also make sure that we have enough access to vaccines so that we essentially are not left behind in this race to a post-COVID era. And so we have about 7 countries in Africa currently that are able to participate at any level of the vaccines value chain. So any aspects of that manufacturing, whether it's packaging, research, or throughout that whole chain. And one of the, or 2 of the ongoing efforts for developing the COVID vaccines are currently in Nigeria. Dr. James hasn't spoken about that yet, but his lab in NIMA, the National Institute of Medical Research, is one of the ongoing efforts to produce COVID vaccine locally. We also have Dr. Happy with HJID, who is working on similar. So very quickly, we wanted to share some information on those ongoing efforts to manufacture COVID vaccine in Nigeria. And then we also would take on questions around, this goal or idea of us manufacturing our vaccines locally and beginning to contribute to meeting our needs. So we'll just call Dr. James back quickly to give us a summary of what they're working on at NIMA. So just a few minutes, 2 or 3 minutes to discuss that. We don't have Dr. Happy with us today because he unfortunately had some other engagements at this time, but we do have a recording and we'll also play that with everyone here to just also be informed about that other effort. And I think some of the things that they share, especially around how they progress, will help us to really discuss about, how we can improve our prospects. So, Dr. James.
Okay. Thank you very much, Tara. Well, for us, we started because NIMA used to make yellow fever vaccine many years ago, probably before when I was born. And the first set of yellow fever vaccines in West Africa, came up from NIMA via eggshell production. And over time, due to good governance, ironically, we lost a lot of things, and brain drain. We lost quite a lot of very brilliant research persons or personnel, and here we are today struggling to see how we could make vaccines for human use. Interestingly, some of those things that we lost were picked up by some other African nations. Senegal today, they produce yellow fever vaccine at the institute, at the Pasteur Institute in Dakar. And and some of those things, when we look at some of the technologies involved, we discover that in making the traditional vaccines, it's not a big deal. What matters many times is how safe in terms of in the preparation process, and the regulatory processes are very stringent. How can we cope or update or upgrade our standards to meet up with this processes? But what we try to do in NIMA is to look at the new technologies, in vaccine, not the very new ones, but um, let's say the middle age vaccines, such as the recombinant proteins. So we began to develop templates for cloning of pathogens in E. coli, so that we could have parts of viruses or pathogens that we feel are very immunogenic based on our studies in the lab, have them cloned, purify the proteins, and test them on animals. And that led us to some vaccine candidates in SARS-CoV-2 that we are currently testing, in rabbits. And we are also using that to develop our own in-house diagnostics, because we discovered that we spent quite a lot of money on importation of diagnostics that involves, antibodies. So what we did, or what we've started doing, is to start injecting, chicken, with most I, which we use for some of our ELISAs that we are currently testing in our labs. And we also have several tissue culture labs in NIMA. And for you to manufacture vaccines many times, you need to have a very good tissue culture lab and a virology lab. So in the last 3 years, we've been able to develop our tissue culture labs, bring them back up to speed. We've been able to grow the virus in the lab. We're concentrating the virus in our BSL-3 laboratory and trying to kill the virus, and we test as well. So what's the essence of this? This could help us in making killed vaccines, and that's the approach that India, in making their own local vaccine, because it's a fast approach if you have like biosafety or higher biosafety level laboratories where you could grow some of these pathogens, kill them, and have them tested. And because this is not much of a new technology, you can You can have them tested quickly and have them deployed for production. But the main challenge that we have is that even if we pass all of this preclinical stages, moving to the clinical stages with some of these vaccines might be a big challenge because I don't know if NAFDAC, I don't know if they've been able to acquire their tier 3 approval for vaccine manufacturing. So it might be a big challenge, even if you have a vaccine candidate, to move ahead. If NAFDAC, who is actually the regulatory body, is working very hard, that I know, working very hard. That's if they've not even acquired the approval, to start giving approvals for vaccine manufacturing. But that's what we've been doing in NIMA, and
Thank
efforts
you.
are still ongoing, and we hope to share our results with the public. So, thank you.
Thank you so much, Dr. James, and well done to you and the team on the efforts so far. We'll definitely be looking forward to, some good results coming out of your lab. And so just very quickly, I'm already hearing some challenges coming up, but before we dive into that, we're going to quickly play a clip of Dr. Happy from ACEJIT, who will also share some of the progress from their vaccine manufacturing.
Can you hear me? Is that your sheet? Maybe I'll do it again. I think it's showing the bits.
To hear you talk about some of the efforts that you're, currently working on as regards to the COVID vaccine. So including some of the genetic research sequencing that you've been doing in Nigeria, across Africa, and then also how that has led to now you're researching a vaccine candidate. And then also if you can just tell us about how far you've come, what are some of the prospects that you've seen with this vaccine, and just really sell it to us.
Well, thank you for having me. And I'll probably start by saying that we've been at the forefront of many epidemics in West Africa and in Nigeria before COVID. So our work is really built on the experience, or leveraging the experience that we have built over the years from handling all of these epidemics. So with Ebola, Lassa fever, monkeypox, yellow fever, and others. So, and as such, when COVID struck, it wasn't surprising that the Nigeria Center for Disease Control felt it was very important to send the first sample from the first index case in Nigeria to a lab for genomic characterization. So we did the genomic characterization within 48 hours. I made this information available, not only to Nigeria, but to the global health community. And this was done within 48 hours. And this is a speed that is unprecedented so far. But after that, we went on to continue sequencing genomes from Nigeria and then and many other African countries. So and then this information, sequencing the genome was not just for the purpose of just identifying variants, but it also was a purpose to identify hotspots, identify variants that could be highly transmissible, and then make this information actionable to the Nigerian government and then other African government that we're supporting in order to respond to the pandemic. So through that effort, we've been able to support countries like Cameroon, Sierra Leone, Liberia, and then others, Somalia and other countries. And that has really helped because they could actually see the type of variant that are circulating and they use this information in order to respond to the pandemic in their countries. But beyond that, we've been able to use the genome sequence of the virus to develop a rapid diagnostic point of care, a rapid diagnostic and a point of care diagnostic test, a 5-minute test that can identify SARS-CoV-2, and its variant. And this test, as I speak to you now, has been approved by the US FDA and is being used in the US. The second thing that we did eventually with the genome sequences, not only from Nigeria, but for Africa, was to leverage a platform that we have built over the years from grant from the BBSRC and the Wellcome Trust, to develop a vaccine candidate. And then the Diosyn COVAX that we have developed, it's the vaccine candidate based on genomic data and on the sequences of the virus circulating in Nigeria and other West African countries or African countries, is really a vaccine that Africa needs to protect African populations and then others and then the rest of the world. We developed that very quickly, leveraging a platform that we have built before to develop a trivalent vaccine for monkeypox, Lassa fever, and Ebola. So when COVID struck, we just pivoted that platform for COVID, and we're able to, develop this vaccine candidate who has gone through preclinical trials. And the preclinical trial against not only the original lineage of COVID, which is lineage A, SARS-CoV-2, which is a lineage A, but against all of the other variants. We have 98% protection in animal models. And we're at a stage whereby we want to move this forward, to clinical trials. Unfortunately, we don't have the resources in order to move to the clinical trials. And that's where we are at the moment. Over.
Thank you so much, sir. And so that kind of leads.
Okay, thank you for that. We just kind of wanted to get some input just to share some of the great work that's being done. And so we'll come back to our panelists for questions. Yeah. Sorry about that, everyone. Okay, all right. We've been able to see that there are challenges all through, whether that's through the clinical trial side, through the actual manufacturing side. And we kind of want to dig a little bit deeper, into the manufacturing aspect of things. I would like to call on Dr. Ngozi. I think it'd be great to hear your perspective around some of the bottlenecks that you see in Africa when it comes to manufacturing enough vaccines to meet our own needs, as well as, do we need to manufacture our own vaccines? I think it'd be great to hear what you have to say.
Okay, I think those were I'm extremely excited because a lot of times we think we have to go to the West or go to somewhere else to kind of solve our problems. But this is great news because we are taking responsibility and we are able to, create solutions to our questions and our problems. And the three questions I actually had was, I was interested in knowing about how we were going to go about clinical research when you get to phase 2, phase 3, and phase 4 trials, how we were going to conduct that, because that now involves human beings and actually trying out those vaccines on people, healthy volunteers. And I was also interested to know how we get funding for the research, because research is big business and big money. People think that the COVID vaccine that we got, the Pfizer vaccine, was just, we developed a vaccine within months. That's not true. That technology had been researched and studied for over 10 years. And just like the last speaker talked about pivoting, when a new problem emerged, they now pivoted and tried to see if they could use the same technology, the same, things they had done for Ebola, for the monkey, I think it was the monkey virus, the yellow virus or something. And then they now began to apply that same thing to SARS-CoV-2. And so I wanted to find out I guess those were my questions. They were actually questions more than comments. And then your question to me was what my thoughts were about manufacturing. We don't have a good pharmaceutical manufacturing base in Nigeria, but we can, because if we're able to do the research that is needed to be able to develop the virus, then obviously we also have we can do the manufacturing. And I've been interested in pharmaceutical manufacturing in Nigeria for a while now, but I think some of the challenges people have had is, challenges around energy, challenges around water supply, challenges around things like that. Not that they can't do it, but some of those things become challenges and bottlenecks. So I think the three things, take away from my perspective that are bottlenecks is, one, how are we going to conduct clinical research trials, because we need healthy volunteers and we need the finances required to do that. Two, how are we going to start using private sector and the public sector to develop some sort of pipeline for the resources, financial resources primarily, that is needed to support what these two labs are doing. And then the third thing, to begin to discuss the challenges around manufacturing, which is usually around energy more than anything else. So absolutely excited that we're actually doing this. We are creating our own solutions, and that is absolutely phenomenal. So I'm excited that that's actually happening.
Yes, so we're all very excited. I think it'd be interesting, from our panelists here, just input on some of the questions that Dr. Ngozi brought up. I think Dr. James may be in a good position as well to maybe tackle one or two, even Dr. Ehi as well. So I'll bring in Dr. James to kind of go in and, from your aspect or your angle, right, looking at the fact that you're working in NIMA and the work that is going on there, what are some of your, kind of responses to the questions?
Thank you very much. Even though my speakers are not that loud, so it's been a bit difficult for me to hear you, and I'm also at work. Well, the manufacturing aspect goes beyond electricity. It goes beyond good water. You can get water. You can buy equipment that can give you type 3 water. You can use solar to get power. You can get generators. But we have some more complex challenges. It will be shocking to note that even importation of the reagents, quality reagents, chemicals that we need, is a big problem. The reagents you buy for $10 in the US or some other countries, you end up to find out that your own budget in Nigeria is about $150, and you'll be shocked. You succeed in paying the $150, your items get seized by a custom officer, asking a government agency to come and pay to clear what is intended for research. So we have a very, very, very complex challenge, but we shouldn't always look at the negatives. right? Because if we keep looking at the negatives, we will never ever do anything. It is not only Naima that is working on vaccines. I'm aware that Usman Dan Fodio University in Sokoto, they are working on DNA vaccine for Lassa. Some other groups who do not have a wet lab laboratory have been able to come up with some bioinformatic, candidates. But nonetheless, we are all making our efforts. Then how do we transition to clinical trials of what we've done? So the trick we are using in our institute is to see how we can help conduct a clinical trial for some already made vaccines, you know. So we are working based on their templates. We are going to conduct their clinical trials on their behalf. We are going to help them generate their data. And we are going to use that to learn about all the possible pitfalls that we might encounter in the near future. But I see vaccine manufacturing as a great opportunity, for Africa. And but the but the other big problem is everybody wants to run away. So so if we keep at it, we keep generating laboratory data. I think we can do a lot. And another challenge is that it's very difficult to have foreign governments come to fund research on vaccine development. No, they can fund clinical trials to test their vaccines on our people. But it's very hard for us to get funding to say that we are developing a vaccine in Nigeria. The only way you could get funding for that many times is if you have to collaborate with a lab in the US or in the United Kingdom or some other Western worlds. And by the time you come up with your new candidate and you need to file a patent, obviously you can't file the patent via the Nigerian institution. It has to be via the foreign institution. So at the end of the day, it's no more a Nigerian vaccine because if you need to buy licenses for manufacturing, you're paying, to the foreign institution. But we need to come together and begin to discuss possible challenges, possible ways. And I believe that in some day we can begin to have modular manufacturing systems where we can even manufacture about 500,000 doses in 6 months. And I think that would be a very, very big step for Africa. Thank you very much.
Here we go. Okay. Thank you very much, Dr. Ayo. I think very interesting and strong points there. Really looking at the fact that, right, not Naima is the only one kind of, doing some of the research. I think even on my end, it'd be very interesting to see what private labs are doing and what private research entities are actually doing in terms of developing or, working on vaccines. But I think, like you said, we should also definitely look at the positives and look at some of the good work that's already being done versus looking at maybe some of only looking at the challenges. I think Dr. Ehi, it would be good to hear sort of any input you have, right? Kind of around the vaccine topic. Even as it pertains to NCDC and the work that's being done there. Any comments from you on this? If he's still there. Hi, Dr. Ehi, are you still with us, or did we lose you? We may have lost Dr. Ehi there. Okay. Chike, Dr. Chike, while we potentially get Dr. Ehi back here, any comments on your end regarding vaccines, manufacturing, and even really, I think an interesting aspect to look at really coming from your view is sort of, the sentiment around it, right? Has NOI polls done any sort of polling around people wanting to take the vaccine or, who's taking the vaccine? Do they trust vaccines? It'd be interesting to get some perspective there.
Yeah, thanks, Jackie. I think vaccines are really an interesting topic, and I'm really excited with the comments from James and the speaker that wasn't around to know that we're actually actively working to try and get made in Nigeria vaccines. The truth is that there's still a lot of conversations that need to be had about the uptake of vaccines by Nigerians, particularly the COVID vaccine. And Dr. Ngozi did make a point that is very valid. The people do think that people went to bed one night and woke up and decided to give us a vaccine. So trust matters. And one of the things that have come out from this conversation is how much government needs to put in effort to gain the trust of the people back. And I think that is very critical if we're trying to get people to get vaccinated. I mean, Nigeria has its own peculiar challenges with even regards to the regular immunization schedule, not to speak of a COVID vaccine. So we do need to have a very structured and deliberate way of putting the vaccines out. And yes, I know we did conduct a poll at the earlier stage before the vaccine was introduced in Nigeria. And at that point, we had 71% of Nigerians that said that they are willing to take the vaccine. However, since we've been trending that number, from that 71, it started dropping a bit. Then after a while, it started picking up and it's probably back around that same 71%. It's expected because at the beginning, people were a bit wary of the vaccines, and that as they've seen that more people have taken the vaccine without any reported side effect, and more people are back willing to take the vaccine. But there is a lot of questions that people ask around the efficacy, the authenticity, what's the other word again? Safety of the vaccine. So those are the questions that still need to be answered and answered deliberately to get people online. And I think one of the things that we are also, the government has to be, or whoever is managing the vaccine has to be very transparent in information that is being shared with regards to the vaccine, both in its deployment, its procurement, its deployment, and how it's going to be monitored going forward. That's one of the ways to build people's trust. And I must say that let's not think that this trust issue is just the general public. Even within healthcare workers, there are challenges around trust of things that are coming out from the government. So I think these are the things that we need to focus. Like, for example, these vaccines that are being produced in Nigeria, I think there should be a little bit more information out there on what is being done to develop our own vaccine. And then people need to be carried along as we move down the line of for this. Thank you.
Sorry, I've been on mute. Thank you very much, Dr. Shike. That's what I was saying. And as advocates for this conversations, we've also, gone ahead to do our own poll, and it was kind of interesting to sort of just get some of these sentiments once again, looking at what people think about the vaccine, why they're hesitant, or maybe even if they're not hesitant. So folks that actually responded to our poll, 50% of people had actually already taken the vaccine, which we thought was pretty interesting and pretty good. We had about 30% of people say, they were hesitant to take it because of side effects, either immediate side effects or side effects in the future. We also had let's see here, just looking at some of these numbers, around 20% of people just generally concerned with the safety, being that the vaccine, quote unquote, came to the market really quickly. But as you've heard from Dr. Ngozi, that like the technology, had been created, 10 years back, right? This was just something that was built upon and utilized for, a specific scenario just like this. Something interesting we saw as well was, in terms of gender balance of the people who have already said that they have taken the vaccine, about 76% or so were women. So that's kind of interesting. And then we had, about 78%, were women, and about 21% or so were men that had taken it. So just kind of some interesting insights that, we're going to send out the, the full poll that we took, the full survey that we took, and some of the answers, because I think some of these questions and responses were pretty interesting. Taking here. But once again, I just kind of want to pause and say a good thank you to all our speakers so far, all our panelists. It's been a very sort of interesting conversation, and I think we've had a lot to digest and talk about here. And for the sake of time, we want to kind of round up on our end, but also provide a call to action. So I'm gonna push over to my co-moderator here, Tyra, to kind of give us the ending comments and go from there.
Thank you. So I would like to end on a very positive note here. I think that I would just like to report that earlier in conversation, we saw that, most of us are in agreement that Nigeria, Africa as a whole, has done a terrific job. Well, let me not say terrific, but a good job given the resources we had to address the pandemic. We saw that there's room for growth, and I'm glad that there is some kind of light being shed around those conversations about what we can do moving forward, how we can increase our preparedness. And then finally coming to the conversations around vaccines, I think it's very laudable that we have local initiatives that are taking this forward, that we even have across the continent, like I mentioned earlier, other efforts that are beginning to come up. We have conversations happening globally about how to support efforts in Africa and other regions of the world to become more self-reliant in manufacturing vaccines, especially, I'm sure lots of people are aware about the recent news about, the US backing IP sharing, and also France coming on board, and just other conversations. I think this is great. I think that we need to continue to support homegrown solutions and homegrown strategies that would help to address our problems within our context and to help us, to move forward and become more self-reliant. And so with that, I think that it's been very, very fun discussion so far, and it's been great having panelists on here that have helped to kind of contribute to this conversation, and we're very grateful to have all of you here.
Thank you, Tyra, and big thank you once again to our panelists, our speakers. Thank you to the attendees who were able to make it and join on this conversation. I know it's in Nigeria right now, it's a Friday afternoon/evening, so I know folks are kind of ready to kick off their shoes and just enjoy the weekend. So we really appreciate everyone joining in on this conversation. I think the last pitch I would like to say is, follow Africa Policy Conversations, right? We are a group of young people, as I mentioned in the beginning, who are passionate about policy in Africa and making a change. You can check out our website, theafpc.org. Join in on other conversations. Like we said, this is just one of many series we're going to be sort of going through, particularly around healthcare. We have other conversations coming up in the near future. So follow us on all our social media handles. Literally just Google Africa Policy Conversations, will pop up. And then, we'll take it from there. So thank you once again, everybody, our panelists. We are so, so grateful, and enjoy the rest of your day, everyone. Thank you.
Thank you. Thank you. Thank you. Bye.
Thank you.
Thank you.
Thank you so much, everyone.